Good morning again. So we are about to start this webinar. Mauro and I will be on the background answering your questions, and of course our specialist Enrico will be here together with our model Federica. And so I think if you don't have anything else to add.
No, we just want to welcome our specialist Cristiana from Brazil, and we did micro. You have to switch on the micro. And welcome to Chris, and she will relate and apport a lot of experience in this kind of treatment and pathologies of today. So nothing else to say. Go with Enrico that will explaining you. Enjoy the webinar. Bye bye.
See you.
Hi Chris, good morning. Can you hear me?
Hi Enrico, good morning. I can hear you perfectly. Yeah.
Great. So
Be with
thank
you
you
again.
Really so special thank you to you, because I know it's very early in Brazil right now. It's 5 AM, so really a special thank you to you that you're here with us for enjoying this webinar and share your experience on the rehabilitation of the back, of the spine, of course. And we will talk about myofascial chains also. So really thank you. You already had breakfast? Do you have
Yes,
your
I
coffee?
did. Everything
Great.
all right for the webinar. Thank you for having me.
You're welcome, absolutely. Okay, so have just a brief menu of the day. Okay, so the menu of the day will take a bit of very super short recap on the method that we already have seen on the previous webinars. We already talked for the last 2 webinars about the method, about the introduction to the instrumental assisted soft tissue manipulation. We spoke about the functional diagnosis and the clinical reasoning. And today we're gonna share and discuss with you, also with all the people that is following from home, back pain, sciatica, hypermobility, neck pain, some examples on cervicobrachialgia, and also the temporomandibular joint dysfunction. I will ask from now that if you get some questions, because we receive really a lot of questions in these days about the previous webinars. So people want to go back and see the webinars again. So please don't hesitate, type your questions, and we are here for answer to you. Also, we will have some integration also with the hands-free method, like the previous webinars. Okay, so very quick recap. You already, I think you got the method, the PGE method. So remind the power, the geometry, and the electrode. We have already understood how managing the power, we can obtain different biological effects on tissues. We were speaking about this specific therapeutic window and the 3 therapeutic windows between 30-35, 35-38, and 38-42 degrees. Then we were speaking about the geometry, and we understood how to use an opposite geometry like this one, the complanar, and also we understood how to use big geometries or short geometries. On the other hand, we have understood something about the electrode, the type and the size. So it could be capacitive, like this one. Remember the insulated one, okay? Depending on the size, you have different superficial effects. And on the other hand, we got a resistive one that, depending on the size, we can have different depth levels. I want to show you something also with our model, please. Good morning, Federica. Please lie down here for this 10 degree. I want to just remind you that this concept of geometry is the same also with the fascia tools. When we use, for example, an opposite geometry, and we are working with a very small surface like the edge of the dia blade large, we are doing a resistive treatment, like in this way, is an opposite geometry. And by the way, we understand that we are using a very small surface, so for this reason, the energy will be concentrated in the upper part, in this case, of the limb. Okay, but if we change the area, like just modifying our position of the tool, just increasing the area that is in contact with the, in this case, with the leg, we can reach the deepness of the tissue, just changing the position of the tool. So this is exactly what I already explained on the previous webinars. So small resistive electrode, quite superficial. If we enlarge the electrode, we go more deep. All right, thank you very much. You can stay here with us, of course. So then we were speaking about the fascia tools as a detecting and also a treating tool for the restriction of the myofascial tissue. We have 4 of them. I think you understood something. We saw some examples also with Diego Mantovani with the DIA trigger. This one, that is a thumb saver. Today we will see some examples on the back. The DIA spine, today is also the day of the DIA spine, of course, because it's designed exactly for the spine joints and anatomy. And then the 2 blades. Okay, last time we were speaking about the Chinese medicine, traditional guasa, okay, that gave the beginnings of this technology. And we were speaking also about the fascia, just the basis of the fascia that we always have to be very clear in our mind. Can you have a zoom, guys, please, just on this picture that I think is very important? So you have to keep in mind the 3 layers: the superficial layer, the deep fascial membrane, and the epimysium. These are the most superficial fascial layers that we have to be focused on. And here we can find in these first 3 layers the famous densification that we were talking about in the previous seminars. This is the superficial layer, the superficial fascia. Okay, this is the deep fascia. Then we get the epimysium, and finally the muscle. So it's a quite long way to reach finally the muscle. We already spoke about this incredible web of connective tissue, about the sensory organs. So we understood the key rule as a sensory organ. These are all receptors that we got on the fascia, and also the connection between the central nervous system and the autonomic nervous system. And so we understood how we can also have effects on the hypothalamic and the local fluid physiology. Okay, so here we already see a very short video just for understanding and have a brief recap on how the tools works on the fascia. So this is the web. It is full of receptors, as we said in the previous pages. And when we have when we do the treatment, actually we are trying to restore the sliding between the tissue. Okay, so the dermis, the muscle, here we get the fascia. When we get the densification, you're going to lose this movement. Okay, and you can find, you can perceive under your fingers. Also with the tool, you can perceive the densification and you can treat. As you can see, the tool is always in contact with the skin. You never take it away. Also because you benefit from the current flow of the TECAR device. So with the mechanical technique and with the warming effect, you are going to restore the perfect sliding. As you can see, you can also restore the neuroreceptors, mechanoreceptors communication. So this is the very important thing. It's not just a mechanical thing, but as you can see here in this quick animation, there are some signals that are moving to our autonomic and central system. All right, this is the superficial fascia. It's early morning, so I don't want to put some dissection cadaveric images. Okay, so we can go away, ahead. Let me check. Okay. Last time we were speaking also why the fascia goes into this function. We have to keep in mind the three main factors. The mechanical one, we were speaking about bad habits in terms of biomechanics, posture, wrong patterns, wrong movement patterns, okay? On the other hand, the chemicals, remember the hydration, the nutrition, very important also to suggest to our clients, to our patient to be well hydrated before and after the treatment. And especially for chronic pathology, for chronic myofascial pain syndromes, is the chemicals or the nutrition it has a very important role. Okay, so also for solving in a definitely in a complete way, we can say the pathology. The third one is the psychophysical. Just imagine this. Yesterday, I saw a patient that has a herniation of the disc. And the point is that the herniation, of course, is a lesion, we can say, of the tissue, but there was in this patient, like in a lot of the neck area patient, some problems with the breathing, okay? This patient couldn't breathe in a proper way, so because he has a very stressful period, okay? So we were in this area here, so some in the psychological and emotional troubles that can affect our breathing and can densificate the neck area, we can say, and of course the herniation was getting worse, just starting from something quite distant from the anatomical part. Okay, going ahead, we were speaking about the indication. We already know this, or the condition in which we can use the IASTM technique, and also the contraindication. Just remember there are not so many. The compromised tissue, so we need to have the integrity of the tissue. We cannot use if we get pacemaker or some devices implanted, or if we get some deep vein thrombosis. And be careful in the cervical carotid sinus, so the anterior part of the neck. Today we will do some examples also in the anterior part of the neck, and that's all. So the topics, the points about the physiology, very quick. We spoke about the fibroblasts, the role of the fibroblasts that are well stimulated, and with the tools we can stimulate and re-promote the healing process, going back to the normality. This is the MCL, no? Uninjured MCL. This is an untreated MCL, and this is the treated MCL at 4 weeks. And you can see that it's quite similar to the first one, to the untreated one. On the other hand, we understood the nervous interaction. So by treating the fascia, we have a direct stimuli with the receptors, and we can have a reaction mediated by the central and autonomic nervous system. So for reorganize, for example, the movement patterns. This is a classical example. On the other hand, we got a warming effect, very important, connecting the device with the tools. I haven't talked that, of course, we can use the 5000, DIACARE 5000, and the DIACARE 7000 as well. So both the device of Globus can be connected with the fascia tools. Okay, there is just one blue cable that is the same one that we use for the hands-free method. So using the warming and also the benefits of the TECAR technology can really achieve a different way of using the tools, because we don't need that energy, we don't produce any pain in the patient, and no ecchymosis on the patient. So it's really a different thing, a different way of working. I suggest you to try, if you can, maybe in some place, because it's something really that a physio has to try, I think. On the other hand, the benefits for the physios, of course, because we understood the rule of save our hands, and there are a lot of studies that are speaking about the relevance of well, work in a safe way, right? without any work-related pathologies like arthritis of the thumb, for example, and all the pain related, especially on the first finger. We saw also the techniques that are doing some aggravation, like the PA mobilization. That's why we developed the DIA spine. Okay, because here you can have a very easy way to perform a PA mobilization, the soft tissue massage, the malleable mobilization, and on the other hand, the trigger point pressure. That's the reason why we have the DIA triggering. Also, with the DIA trigger, you can perform a perfect ischemic compression without staying with your fingers for minutes in the same position, and with the increase of flexion and well, all the things that could damage your finger, of course. So going ahead on the last part that we have already seen on the previous webinars, we are speaking about on the functional diagnosis and clinical reasoning. This is always important to have clear in our mind, especially when we are using some tools. We have to identify the structural or the functional pathologies. Is this a structural pathologist? Okay, maybe we are talking about something like a traumatology or post-surgery patient. It's quite easy, we said, to have some imaging of the damage, okay, for example, in an MRI or an ecography. Could be very usually, it's very usually find an acute inflammation. So there is a lesion, that's the point, okay? So in that case, the suggestion is not to use directly on the lesion side, on the side of pain, but on the proximal and on the distal part. All right, so if for example, we get a lesion on the tendon, on the patellar tendon, if it is a fresh lesion, so don't go straight with the tool directly, of course, on the side of the lesion. Maybe we can arrange all the other area, maybe the hip, maybe the quadricep, to solve the tension, to release the tissue, to increase the healing processes, but not directly on the side of the pain. On the other hand, if we got a functional one, so something more chronic for sure, something that where we had a movement dysfunction correlated to bad habits, also the nutrition bad habits and postural, of course, and we have excluded the red flags, so we are not talking about red flags. So in this case, imagine, for example, a chronic tendinopathy, always speaking about the neck, the knee, for example. Of course, we can do directly on the side of the pain, and also proximal and distal. So this is the two main difference that we have to be very clear in our mind. There are also some mixed case, and on the mixed case, I suggest to use the more soft way, so upstream and downstream of the lesion. Okay, now we can go directly on the practical part. Chris, everything's okay for you? Can you hear me?
Yeah, everything all right. Just great.
Was it clear? Was it clear? The images is good?
Everything clear. Yeah, perfect. Very good.
Okay, do you have any questions about the introduction, about this brief introduction part?
Well, I guess that for now everything is okay. You were very clear.
All right, all right. You receive any questions from the previous webinars, maybe?
Some, I'm sorry.
Do you receive some questions from the previous webinar? You were speaking the previous days about some questions, or everything's okay?
Okay, I got a question from a friend, a physical therapist here from Brazil, but I guess maybe we spoke about that, but that's not a problem to say it again. If why we couldn't, you don't use the capacitive mode with the fascia tools? Some people asked about that. Not just one, but some people asked about that.
Nice question, nice question. All right, so the tools are a metal tools, as you can see. So with the metal tool, we can provide a resistive treatment, of course, using the decapacitive. We can, of course, we can cover the tools with a resistive material. But the point is that the fascia is a quite dry tissue. Okay, so the right method is the resistive one, not the capacitive. So that's the main reason for treating the fascia. We need resistive electrodes. So for this reason, the tools are in metal, are made by metal, and we get different options if we want to select superficial tissues or deeper tissues. We can modify the frequency. By using different levels of frequency, we can stay more superficial with high level frequency. Okay, with the lower level frequency, we can reach, for example, deeper tissue. For example, I want to show you something. Speaking about the knee joint, just because it's quick to understand. If you want to do a treatment on the patellar tendon, maybe we can select a 700 kilohertz because it's quite superficial tendon. So we can easy treat, especially if we want to treat the anterior part of the tendon. But if we want to go on the deeper part of the tendon, maybe on the posterior bursa, we can decrease the frequency, reaching the 400 kilohertz, for example, always with the same technique. Always we are treating at the tendon, but we can increase the dip. So I hope to answer to you in this way.
Yeah, sure. Very clear.
Okay, so I think we can go directly on the back part. So everyone, this study is made in the UK, but is talking about the industrial countries. I think it's the same in Brazil, that 80% of people is suffering at least one in a year of back pain. Okay. At some point of their life. So we have to exclude, first of all, the red flags, of course. So the red flags are those symptoms that we have to exclude when we are evaluating a back pain. So numbness or tingling around the genitals or buttocks, difficulty in peeing, loss of bladder or bowel control, chest pain, all the typical red flags. Of course, we have to exclude them, and in that case, we have to recommend the patient to go directly to the emergency. But in all the other cases, we are talking about unspecific low back pain or back pain. Okay, so back pain could be, of course, a low back pain, a dorsal or a neck area. Also, it could affect the head, could affect the buttocks. We could have some irradiation like for sciatica. So we are talking actually about a very huge, enormous, I think, group of pathologies, different pathologies. But talking about the very typical, aspecific low back pain, actually the evidence-based medicine guidelines suggest just one thing: keep on moving. So we have to keep on moving. We don't have to find an excuse to lie down on the sofa, to lie down on the bed. But they prove that there are some effects with the analgesic and muscle relaxant drugs, in this case, and pills. Also, physical activity, exercise. I can say specific exercise therapy and supportive corset could help. And also manual therapy. So these are the three main areas that the evidence-based medicine suggests to us. So we have the ability with the TECAR device to have all of them, because we can perform manual therapy. So we can use the handles to performing the manual therapy with of course, with the classical handle we can use for doing, for example, manual mobilization, also manipulation or massage. We can do for sure some physical activities, some exercises directly with the hands free connected to the machine. And for sure we understood how we can induce an analgesic effect and also some muscle relaxant effect. So we have really the all the three categories of effectiveness can be also made with this kind of devices, with this kind of technologies. So I think we can do an example. If Francesco can made a zoom maybe here. So on the machine, directly on the machine, I would like to show you something. Yeah, just 1 second. Here we are. So just one. Oh, that's right. So here we got the atlas. Using the atlas is very. Maybe there is some issue with the color. It's better. I think you can see a bit better right now. So we can select, for example, the trunk area and find our pathology, for example, an acute lumbago, a chronic lumbago, a sciatica, slip disc, whatever we want. For example, just something very easy, muscle fatigue. Yeah, for example, a muscular contraction, okay? We get two phases. The first one is resistive, the second one is capacitive. For each phase, we have, as you know, the images for where to put the patient, okay? And I want to show you something that you can do at your own for produce your own, for example, protocol. If you're talking about a lumbar arthrosis, for example, or maybe muscle fatigue. All right, we got 3 phases, but we don't want to use all these minutes here. So I select the first phase, I reduce the time, maybe just 3 minutes for capacity preparation phase. Francesco non si vede. Francesco non si vede molto male. I'm sorry guys, I know that it's not so clear right now. Riesci a chiamare Mauro?
Prova,
non so qua.
easy. Okay. Let me try.
The focus seems doesn't work so well. So on the second phase, we can, for example, select 5 minutes, and then on the third phase, just a couple of minutes. So I produce a new protocol with less time, always with 3 phases for muscle fatigue, for example, and I can save it. I can say, for example, as for example in this case for Federica, fatigue, we can say relax, massage, okay, and we get it. And we got the protocol on our programs. So I find my protocol and I can use it, of course, with the 3 phases: capacitive, resistive, and capacitive again. And here we are ready to start. Okay, so let's start with something very, very easy. Okay, so questo lo mettiamo sotto qui. Ok, ti appoggi. Riesci a fare uno zoom out? So what I'm doing now is going more on the roots part. Just imagine we got an example of sciatica pain. Okay, so we are talking about some problem with the root of the sciatic nerve, for example. And as we know, the problem could be made by herniation of the disc, or a spinal stenosis, or just a compression of the facet, or like we said last time, with a deep glute muscle problem, like the piriformis, pathology, okay, syndrome. Or we can have some issue, some problem along the root of the sciatic nerve. So in this case, of course, the evolution is always the first thing that we have to do. we can imagine, we can suppose that Federica has a problem with the quadratus lumborum. Okay, so maybe a stiffness of the lateral part of the back. I want to show you here. We got also the like the previous time, the 3D atlas, where we can easily identify the muscles that we are talking about. So always we have to be very clear in our mind what we are talking about. So I'm talking about quadratus lumborum, that is this muscle here. Okay, I hope could be quite clear on the screen. Okay, so I want to release all this muscle. In this case is the right side muscle, so it's this one. Okay, for increase the opening on the lateral part of the foramen of the vertebrae. Okay, so here we go. A good idea could be to prepare the tissue with just a bit of capacitive treatment, as we did last times before. So I can just prepare the tissue for release and warm up a bit the tissue. I hope you can see me. Just a few minutes, just for increase the oxygenation in tissues, okay? Okay. Always we have to maintain, we understood how always we have to maintain the contact with the patient. So ask to the patient between 0 and 10, which is the level that in this case she's feeling the warming. Okay, she told me around 2. What about right now? Okay, in just a few seconds we reach the 6. As you can see also on the machine, if we get a double images, maybe you can understand also the Instagram levels. In this case, we got a yellow one, so we understand that we promote some warming on tissues. Okay, so the second window. Okay, after a few seconds of this, we can use the DIA trigger. Riesci a mettere la doppia immagine? Era stata già, c'era già un preset. Okay, the DIA trigger, we can use it on the fascial. Okay, I suggest always to use the gloves when we are using the fascia for be isolated. Okay, I'm wearing the gloves. Okay, so here we are. I show you right here. I put on the inferior part of the handle, the cable, because I want to be free to use the tool. So I'm using on the quadratus. I can slide just over the quadratus. Does it pain? Okay, no pain for her. I can perceive the densification on the muscle. And when I identify the right proper areas, I can also use the other end to stay directly on with this manuality. Maybe you can see me. Okay, directly on the trigger points. So it's very easy to solve the contracture. Before with Federica, we did a very brief examination, very brief, and we understood that he has poor side bending. So the inclination were not so I can say with a good range of movement. So now we want to improve, and we can also combine. Okay, we can also combine with some manual techniques for opening the lateral part of the back. I'm sorry that you see my back part, but I try to do something easy also for you, if you can really understand what I'm doing about. Okay, for example, right here over the iliac crest, there is a very stiff point. So it's very easy to stay here with a DIA trigger, saving my hands and treating. Does it pain? Okay, no pain for that. All right, so have a look about the temperature that we are inducing on the tissues. We're just working a couple of minutes, but okay. So we got 32.6. We can increase, for sure we can reach also the 35 degrees, 38 also. So we can work in here for a quite long time, okay? So this is just an example, of course. So Chris, do you want to say something about this point here?
Well, this particular treatment is very pleasant for the patient. In the first moment that you start to do it, the treatment, the patient always says that his pain goes down. So it's very comfortable to start any type of intervention to start with. I always start with the capacitive mode for some muscle relaxing and some diminish of pain. So the results are incredible.
Okay. Okay. So speaking about the back pain, the sciatica, this kind of pathologies, I think we can combine something with the hands-free modality. You agree with this? Would you like to see something with the hands-free? Okay, so we can have a sit position. We can use for sure the hands-free. For example, if you want to do aerodynamic mobilization, maybe we can have a sit on that part.
Enrico, we have a quick question about
Yeah.
what kind of gloves do you use with the fascia tools?
These are nitrile gloves. So these are black ones, but nitrile is a very good insulated product. So it is not like the simple, how do you say the simple, not the normal one. It's nitrile. It's very easy to find them. It's a very good insulated material. So
Enrico,
yeah.
Here in Brazil, everybody asks if it's mandatory to wear the gloves during the fascia tooth treatment.
Well, it's not mandatory, but I suggest to do, because when we touch the electrode end piece, okay, you are part of the circuit. So there is a very small current that goes through your hands to ground, okay. So it's not dangerous, absolutely, it's not dangerous, because the main current goes on the patient, between the electrode, the patient, and the plate. So the therapeutic current will go on the patient, but just for isolate yourself, for avoid any other kinds of very small current, I suggest to use the gloves.
Okay, thank you.
You're welcome. So, for example, performing some aerodynamic exercises. Okay, so we can put the plate under the thigh here. Perfect. Okay, we can use the automatic electrodes. We already seen how to use them. Okay, for example, we can use a band. Okay. And we can put the electrodes on the lumbar part, for example. Okay, I hope you can see something. There's not so much light here because... Okay, right now. Then we connect the cable, the blue cable, with the electrodes, and that's all. So we are promoting a current on the posterior chain, okay? Forse meglio se togli la finestra. Sposta ancora a sinistra. So we are promoting electric flow from the back part in all the posterior chain. Okay, so I select the hands-free treatment. Hands-free. We can use a medium to long geometry. Resistive one, okay. Okay, we can start maybe with the 50% of power. Always have a look at the machine, ask the patient if the warming effect is okay. And we can add some exercises, for example, some sliding exercises, starting, for example, from the posterior chain of the limb. Just have an elevation and a dorsiflexion, for example. Okay, and dorsiflexion. Extension and dorsiflexion. If there is no pain, we can also induce the extension of the head. When he's performing the extension of the limb, we can extension of the head and going back. This is just for having a sliding effect. All right, or we can combine with a tensioning, or we can combine with muscular exercise like the bridge, like the transverse activation. This is just some examples or one idea. For example, Chris, do you have other ideas, other purposes for back pain or sciatica, or maybe for postural issues?
Yes. For the postural issues is a very good it's a very good treatment that we can combine with TECAR, because as we are working more global for a more global way, it's very let me turn on my camera. It's very interesting so we can hit the tissue as you were performing her knee extension over there. We could see from this lateral view that she was doing like this when you movement her. So these are the compensations of her back muscle chain, you know. And when you hit the fascia, as you told on your great review, when we hit the fascia, it's easier for the patient to sustain the posture. And even so we can, as physical therapists, we can do the corrections that we have to do for the better posture of the patient, you know. So we have a lot of good results with performing the heat treatment of the TECAR therapy combined with the postural corrections that we have to do in the patient and muscle chain treatments. So there are a lot of positions that we can work with the plate or even the hands-free mode, and promoting the stretching of the muscle chain along as TECAR treatment. So the results come faster. It's more pleasant for the patient and easier for the patient to perform the posture that he has, because the thing we do is to put the muscle chain in the most tension position that the patient can, in order to stretch the muscle chain and to put the patient in a better biomechanical posture for him to spend less energy and to not to some joints.
So I know you are an RPG specialist, no? Global Postural Reeducation specialist, isn't it?
Yes, I work with that, yeah.
Great. So let's do an example. Let's do a practical example. Maybe is the best way. Do you perceiving some heating? Okay, lo senti? Okay, he's perceiving the warming right now in the posterior chain. Okay, but I want to stop this treatment. As you can see right now, we got the indication of the second window between 35 and 38 degrees, as you can see here on the machine. But I want to ask Chris to suggest us another posture, maybe using the RPG method. Please, Chris, tell us what you would like to see.
Yeah, just to show a very simple example, maybe she could lay down a bit. Is it possible?
Yeah, for sure.
Okay.
This is a live session, so we can do what you want.
Okay. All right. Let's work on that.
Okay.
Okay. And maybe for this matter, you can use a plate on her back, on the lumbar spine.
Okay. So you want to work on the posterior chain?
For the posterior chain right now, as we are speaking about the lumbar, as you were showing, so maybe we can show some example of that right now.
Yeah.
And the other plate on the back of the thigh.
Okay. The hamstrings, you mean?
Yeah, for the hamstrings.
Okay. Here we go. So I use 2 bands, okay? Do you want to do a monolateral or a bilateral treatment?
You can do bilateral or monolateral as you wish. It depends on the patient and what you're treating. But if we were working on a RPG posture, for sure we would do bilateral.
Okay. I remember it was one of my first methods that I studied, the Suchard and Messier method. So I like that very, very much.
It's interesting because you treat the patient as one, because of course none of us is equal, so we have retractions in different points of the body, and it's very interesting because you can work as an individual retraction in a global way. So we don't treat just the lumbar spine, but we treat the body as a unit. So it's very, very good.
So
and the results are incredible.
So you mean I have to put under here?
Yes, please.
Okay. Bilateral, you mean, isn't it? Okay,
If you can, yes, it's better for us. Okay.
Here you go. Yeah, we have our special model here. Okay, here we go. So you want to promote a warming on the posterior chain from lumbar to hamstring muscles?
Yes, that's it. So you are hitting the posterior chain, and from the position that you are, if you can extend her knee.
All right, so I start the treatment, okay?
Yeah.
I think we can use a large geometry, the third program. Okay.
Yeah.
Okay, I'm putting 50% resistive as usual, 50% of power. Okay, now tell me what to do.
Yeah, so now we are promoting a hitting on the muscles of the back chain, mainly in this area of the hamstrings and the lumbar spine. So we are hitting the fascia and make it more malleable to work. So as you stand, yeah, perfect. As you extend the knee, you know, what you do is you are creating a tension for all of her back chain. And for that reason, if we have some conditions as the hyperlordosis or some retractions in the back chain of her leg or her lower limb, it's very interesting to work in that position, because we can probably ask her where she's feeling, if she's feeling some tension somewhere, and she.
Okay, and in the lower limbs, cosce or polpaccio? On the hamstrings, she said.
Yeah. So the idea is the more hitting you produce, the more the fascia will be malleable for you to work on that. It's like a normal stretching, but for the RPG, you don't work a single muscle as well. Of course, we would have to position her head and her shoulder and her limbs. Everything we should be positioned to tension the whole muscle chain. But in our RPG, we're going to stay in that position. Of course, you wouldn't have to hold her. We have the RPG stretcher, which has a wire to hold her leg, and you wouldn't be there for 12 to 20 minutes maybe. So it's yeah. So it's very interesting.
Okay, remember one thing that we already spoke when we were speaking about the lower limb, also with Diego Mantovani, that when we push more intention the posterior chain, we increase the impedance of tissue. So we are directing the current flow, so the treatment benefits directly on that tissues. And I think that maybe with your experience that you have already tried to use the hands-free method for your low back pain pathologies and posterior pathologies, maybe you have seen something maybe that you you can tell us? Maybe, I don't know, maybe less time of treatment, or what are the expectations?
There are some aspects that are very, very interesting about the combination of techniques. One of them is it's more pleasant for the patients to work with the TECAR combined with the posture, you know, because sometimes it's difficult because you put the patient in a whole tension position. So sometimes to keep this position for 12 minutes, it's really difficult for some patients. So when you do the heating, it becomes more pleasant and more easy for him. The other thing is that you reach your goals for the session with less time, because the thing is you do an isometric contraction of the whole muscle chain, and that, the point of the treatment is to hit the fascia by doing an isometric contraction. As you have another resource to help with the more fast heating, you get to the results with the less period of time. And so it is very interesting because earlier you spoke about the sensory receptors that we work over, and it's very interesting because we have to send to our nervous system the message of the correct posture, so the nervous system will show the body how to keep the correct posture, so we won't lose the information of the treatment that we are sending to our patients. So we have less number of sessions to get to our results, to diminish pain, to correct the posture, and to diminish the overload of some joints. And we can reach the goal for the session in a shorter period of time, for sure.
Nice, nice. I can imagine. Also, well, it seems to be easy to stretch. Seems my perception here, we are using 747 milliamperes, so is a definitely thermal effect, as you can see on the small screen over there. Well, I cannot transfer maybe my sensation, but well, it seems to be absolutely easier to stretch.
Even for us that are watching, we could show you extend her knee in the first place, and now that you're doing, we can see that she has more range of movement already.
It's unbelievable. Okay, nice to know. Thank you, Chris. Wow.
Okay, no problem.
Okay, so all right, going ahead, because we got a lot of things to show today. So really thank you for this experience. It's a long time that I don't use RPG method for re-educate my patients. Well, I think we can combine with hands-free in a very easy way. Also, maybe, for example, lie the patient. For example, what do you think about this? Just lie the patient. After the treatment, you can lie the patient in a stretch position, maybe in a wall, okay? And ask the patient to do an active contraction of the quadriceps without compensation, with the shoulder in a back position, with maybe a diaphragmatic breath. What do you think about it?
During the posture, she will be in isometric contraction all the time. So her head will be positioned and properly, and her shoulder and her hands could be facing up. So we would do tension for the pectoralis as well, and the body will work as one. So it's not just the leg. Of course, we are just showing a position, but the whole muscle chain will be always tensioning, and she will be performing an isometric contraction as well for all the treatment and the posture time.
Great. I want to see you something that in 7 minutes of treatment, we deliver almost 10 kilojoules. So the energy that we transfer to the patient is really a lot right now, 10.6 kilojoules. So the joules are the amount of energy per time, okay? So is the amount of heating that we are producing. So, and actually without doing anything, because my hands are completely free for interact with the patient, for performing exercises. So I think this is a very good opportunity. And the point that I like is that everyone can perform his own technique. Maybe someone more on neurodynamics, maybe someone more in RPG like you did, some other like with proprioception exercises or strength core exercises. So everyone can really perform in his own way.
Yeah, sure. The machine is very versatile, so we have a lot of options. Heating is a great resource that we have for fascia, and the fascia is being very studied nowadays. So it is incredible to combine and then to have faster results with less time of treatment, and the well-being of our patients is the main goal. So it is we get really great results with that.
All right, let's go a bit ahead on the new topics. Going back here on the presentation. So we were speaking about back pain, about sciatica, examples, neurodynamics, RPG. Let's go a bit more on the hypomobility of the spine. The hypomobility is a very interesting topic, I think, because speaking once again about the my patient that I saw yesterday, that she has a herniation of the disc. We are talking in this case about a herniation on the neck. It's a C5, C6 herniation. The point is that if she get an hypermobility on this area, she get a hypomobility on all this area, and also on the upper part of the neck. So always when there is an hypomobility, there is an hypermobility, and sometimes there is the pathology. So in this case, the herniation is not the point that I want to go to treat, but I want to treat the hypomobility. Let's see an example, a very quick example how we can do this. But before to do the example, I want to show you something on the anatomic atlas, the human atlas. Stay there. I can show you in a very quick way for better understand which are the muscles that we want to treat. Okay, so starting from the skin, okay, the first muscle that we got on our back, of course, the latissimus dorsi, then we've got the trapezius, okay, but going a bit deeper on the deeper muscles that are our target, I want to show you some very important muscles that are our targets. For example, the iliocostalis, that as you can see originated also on the sacrum area and is very rich in connective tissue, and also his friend longissimus thoracis. These muscles are very long muscle, always are overstressed, and as we know, under these muscles we got these small muscles that are most famous, we can say, like the multifidus, for example, or the small rotators like the semispinalis. We got a tool, the DIASpine tool, that really can target these muscles and be very specific for every single level, for every single vertebra. So for example, they take the L2 vertebra, so we can easily detect the transverse processes on the right and on the left, and have a very specific mobilization directly on that vertebra. Or for example, if you want to take the L3, for example, so we are very sure to mobilize that single vertebra, and with the benefit of the warming effects, we can warm the tissue that are directly just over the vertebra, like the multifidus. We know from the literature that the multifidus and all this small muscle dysfunction is very important by treating the low back pain pathologies. So I want to show you how it's really easy to treat it. Pancia verso il basso, Fede. I just put the plate under the belly. Always be sure, always be sure that the plate has a very good contact with your patient. So be careful with the clothes, a bit of cream, of course, like always on the plate. Then we can connect the DIA spine, as I told you. I remove right now the hands-free method. Get here the trigger, and here I got this spine. As the DIA trigger has two possibilities, one on the handle and one on the back here. Okay, so I start in this position. That's why, because starting in this position, I'm free to use the lower edge. As you can see, there is a rounded lower edge, very comfortable for the patient, because I can start as usual with a capacitive treatment, or directly with the resistive. Okay, always with my gloves. I put 50% of power, and well, I can go on this part. Maybe it's better. Okay, so I can start with a very gentle sliding over the tissue, just over the iliocostalis muscles, just for warming the tissue and starting the perception of the tissue. For example, in this area here on the posterior part of the dorsal, we get some stiff, more on the right side than on the left side. Are you right-handed? Sei destrimane? Sei destra di braccio? Okay, okay. She is a right-handed, so I think she used more the right part of his body. All right, so it's very easy, and in a few seconds we can increase the temperature of those muscles here. We can go ahead also in the dorsal part, for example. Always with the right amount of cream. The cream is always important for having a good conduction. If I want to speed up the treatment, I can increase the temperature, so I increase the power, as you said before, reaching the 600 milliamperes. Always have a look to the histograms, on the histograms on the screen of your device, so you will be able to identify what you are doing to your patient, and always ask to the patient the perception of the heating. All right, she just perceived a 3 between 0 and 10, so I can reduce the movement over the stiff area, and by the way, I can increase the oxygenation of those muscles, of those tissue, and also maybe you cannot see, but here I can see some red area. I also can perceive with my hand. Always I can ask Federica. Adesso come lo senti? Okay, it's growing up, she says. So it's reaching the 7 between 0 and 10. So it's okay. It's according also with the histogram's color. So we are always on the warming window. Okay. So I give you an example. If I reduce the power, for example, and I put just 20%, and I'm staying here, right? Have a look at the histograms that give us the measure of the thermic effect. Let's wait 1 second more. Maybe. Let's do this. I reduce the time of the treatment, so it's very easy for you to understand what I'm talking about. I put just 7 minutes. Okay, treatment with the 20% of power, and you have a look at the histograms. So now it's very easy to. All right, as you can see, there is a green histogram. So this is because we are not using the right amount of power. If we want to produce some warming effect, we have to increase. All right, this is not enough. So I can increase to 50, for example, and have a look at the histograms, and you will see some increasing on the color on the histobar. Okay, so by the way, after a warming preparation phase, We can change the cable on the lower part. Okay, in this way, I'll be able to have the posterior part of the tool completely free for my mobilization. For example, for Federica, she's very stiff in this area here, in the middle part of the dorsal, medium lower part of the dorsal area. So how I would like to do a PA mobilization. Wait a second, reduce here. So, for example, I can just fix in this area. Mrs. Scott, tell me if it's hot too much. Okay, level by level. So I identify the perfect vertebra level that I want to mobilize, and I can directly mobilize over the vertebra. Every single movement that I do, I'm perceiving the movement of the vertebra, but also after a few seconds, I also perceive the relaxation of the muscles. So the muscles that we have seen just before, the multifidus, the semispinalis in this case, are becoming more relaxed. So I'm after the single treatment, the single level intervention, I'm able to do the manipulation, for example. Later we will see how to perform the right manipulation after a preparation treatment with the DIACARE. Does it pain, Federica? Ti fa male?
No.
Okay. Rilassante? Okay. She said that it is very relaxant and pleasant. Okay. What about the thermic sensation between 0 and 10? Da 0 10. Okay, she's perceiving a 8. So because I'm very fixed on the same point, so I reduce a bit the intensity of the machine, so I can work. I can still work on the same area without increasing so much the energy. Okay, so this is very useful. You can use in this way. So when you get the spine, the posterior part of the I can go. Maybe it's better if I'm coming quite close. You can work in a crossover position, or you can work on the side lateral position. For example, if you want to work on a facet, so unilateral treatment, you can use the spine in this section and working directly over that zygapophyseary joint, always with a PA mobilization or just a pressure over that area. For example, yesterday, this treatment that I did with my patient, we work a lot on the upper part of the dorsal. As I remind you, there was a herniation of the disc C5, C6. So I work on the upper part of the dorsal for increase the mobility, all right, for reduce the stress on the injured part of the spine. And there it was completely blocked, and after 3 to 4 minutes, we solved completely the tension and we recovered the proper fine mobilization between the joints. So it's very important to perform the right treatment, and first of all, it's very important to do the right evaluation, of course, of the patient. So going ahead, I want just to show you, after a very quick mobilization of the dorsal part, here is very easy, for example, to perform some butterfly techniques, okay, mobilization or manipulation, or maybe we can perform a manipulation of the dorsal part. Girati sul tuo fianco sinistro. Allora, questo da sopra la drizzi. Okay. So, for example, alza un po' su, okay, giù. Okay, for example, if I want to manipulate the dorsal part that I've been working right now, I hope you can see we are in the medium and lower part of the dorsal. I can combine the resistance modality to increase the rotation. So I just take the handle, I put on my fingers like this, and I put over the level that I want to manipulate, that I want to increase the mobility, for example, the posterior rotation, okay? And then of course I can do also the manipulation. All right, so just for have a look, speaking about the hypomobility and hypermobility, just for doing some very brief example. Chris, do you have something to add around this?
Yes, this is a very interesting way of treat the patient. For some of my patients, I used to do this on the first sessions with her laying, like you did, and then I like to combine the mobilization of the vertebra. Maybe for the fourth or fifth session, I work with the patient sitting. So we have we can combine like with a mulligan concept. So we can do with the blade in the position of the facets of the vertebra, depending on the level of the spine that we are working, more like 90 degrees or 45 degrees mobilization. It's very interesting with this piece. So great results, and as well, it's more comfortable for the patients, and the mobility comes with in an easier way. So it's great to combine the techniques.
All right. Francesco, do we have any questions?
Yes, we have actually a few questions. They're written in Spanish, so I will try to translate for you. So basically, Esmeralda Banacroy Martinez asks, she has basically patients with sclerodermia localized. Sclerodermia, how do you translate in English?
I don't know actually. Sclerodermia. Okay.
Sclerodermia, and she would like to know if it's possible to use the fascia tools to improve the elasticity of the connective tissues. If the answer is yes, what kind of therapeutic window can we use?
All right. I think we can use just on the surrounded area at the beginning of the lesion to promote the healing of the healthy part of the skin. In that specific case with sclerodermia, I suggest to use the normal unipolar electrodes, first of all, to promote the healing of the tissue, okay, of the skin, and also to promote the immune system also, because we know that there is something related also with the immune system. Going directly with the tools, well, maybe on the most fibrotic areas where there is some scars, we can use the DIA blade small, but not only on the first phases. The DIA blade small could be used, later we will see also on TMJ in a very, very soft way, using the edge. Maybe you can grab the handle close to the distal part, so not here, but here, for having a more precise mobilization where you got a scar, where you got a problem, okay? But you don't want to put a lot of energy on the tool and, of course, on that tissue. Are there any questions, Francesco? Maybe,
yes,
maybe someone for Chris, I don't know.
Well, I asked the question, and whoever wants to answer is, of course, free to answer. Always again, the fascia tools.
Yeah.
If there is a situation with a fibrosis post-chirurgical, for example, lumbar hernia, is there any contraindications in the use of the fascia tools for this kind of pathology?
All right, Chris, one to answer to this question is speaking about using the fascia tools in post-surgery fibrosis, if there are any contraindication.
Okay, we just have to evaluate whatever we are doing at the first moment. Of course, if there are incisions, we can't work with the fascia tool over the incisions, but we can do the rounding area after the surgery, and then working with on the first sessions with lower energy, and then the rounding area, and then the next days there are no contraindications about using that. So it's okay. It's a good resource to restore the mobility of the tissues, and so there's no problem about using that. We just have to evaluate in which area are we going to start to use the fascia tools, and then we go on evoluting with the treatment.
Yeah, great, exactly. Great. There are another question that I saw here on the screen that is asking to us if with the DIACARE 5000, that is this model here, using the hands-free, we have to use the same amount of power, starting, for example, from the 50%. Yes. The suggestion is, first of all, you have to know which kind of electrodes are you using at. So I want to show to everyone that we are using right now the new electrodes, the new adhesive electrodes. These are for surgery purposes also, and here we can increase the level of power. With the previous one, we cannot increase so much the intensity of the treatment. So I suggest with the previous one to use low levels of power, like 20%. And depending, of course, on the skin of the patient. If the skin is well hydrated, is a young skin, of course, it's easier to increase the power. If we got an elderly lady or poor hydrated skin, it's not a good idea to increase with the previous one over the 20%. With the new one, it's easier, and also with those that I showed you just before, the metal one. So these kind of electrodes that are flexible. This is a stainless steel. Okay, we can use with a bit of cream, and of course with this kind of electrodes that are the new ones, you can increase also the power, starting from 50%. Always have a direct contact with your patient. So ask the patient about the sensation, put your hands, use a thermometer, have a look at the parameters of the machine. So always we have to stay, we have to target, we have to reach, okay, the right target. So it could be a thermal or hyperthermal. Okay.
One last question. Yeah, is use TECAR in the treatment of scoliosis?
Yes, it's a good idea. It's a good idea. I love that. I follow a lot of kids with scoliosis since a long time, and sometimes when scoliosis have they say idiopathic cause. It means they don't know the real cause, but actually there are a lot of causes. Could be a perception problem, could be biomechanical problems. So the point is that depending on how long is the scoliosis, long for, we could have some fibrosis, some fibrotic tissue, some densification of the fascia. So using the TECAR and especially the fascia tools is very easy to restore the, as also Chris says before, we can work on the chains, on the musculoskeletal chains. So it's very easy to achieve great results, really great results. So performing the TECAR with the reeducational process, and that is more on the proprioceptive area and the motor control, we can really achieve great results. Thank you for the question, Francesco, really.
Thank you to Anna Maria Butan.
Thank you, Anna Maria. Thank you. Okay.
Chris, so Enrico, can I ask you just a quick question that a lot of friends here from Brazil ask? You showed the new electrode, and some people ask here if we can use any size of auto-adhesive electrode in order to use the hands-free mode.
No, absolutely no. There is a specific surface that we have to use. Good questions. We cannot use the size of the normal electrostimulators because it's not enough for delivery the whole amount of current, and this is a special current. So Globus uses special electrodes with the special centimeter square, of course. So use just the hands-free kit electrodes, absolutely.
Yeah, great, thank you.
Yeah. Otherwise, you can burn the patient. So we don't want you, absolutely, of course.
For sure.
Okay. So going ahead. All right. We spoke about back pain. We spoke about sciatica. We spoke about also spine hypermobility. Now we can speak a bit about neck pain. Well, neck pain is the fourth leading cause of disability. There are more than 30% of the people that are experience some episodes of neck pain, and around more than 50%, around 50% still having some bad experience with the neck pain that, as we know, could also affect the head, could also affect the shoulder, the lower limb, the upper limb, sorry. It's very, well, discomfort, I can say, and it's very common. And I can see a lot of young people, young patients right now that are suffering from neck pain. Even more than years ago, than 10 years ago, for example. That's one of the causes, of course, the mobile phones and all this new lifestyle. Okay, in this picture of Dr. Daniel Ryu, he showed us how the use of mobile phones and have this forward neck position, this bending position, induce a very increase in the amount of the load of our back neck muscles. With 60 degrees of bending, of neck bending, we have a 60 pounds of load on our neck. That is around 30 kilograms. So it's really a lot. And this goes to modify also the posture of the head. So the patients, there are really a lot of patients that are suffering of neck pain. So what we can do? Well, actually, a lot of things. We can do really a lot of things. Face down, please. We can go, for example, ahead with the D-spine. The D-spine could be also used, let me find it. Okay, it's over here. Also on the neck part, for example. Facciano i fianchi, centro il pochino bene, me lo indietro. All right, I don't have the machine, but I want to show you that we can use also the D-spine on the neck area. Always we have to identify the direction of the vertebra, and we have to move on the same direction, of course. We can also treat the suboccipital area. For that area, I suggest the dia blade small, but we can easily treat all the neck part, or as I told you before, also the dorsal part is a key point for all the neck problem, neck pathologies. So this could be a good positioning. So the plate under the belly, we can use the D-spine, okay? Or, for example, in a face-up position, I want to show you something else. Thank you to Federica. She's very kind, really. So dia blade small is this one, is the small dia blade. So this is very, very useful for all the neck problems. I think we can also use the machine in the real way. So maybe with Francesco, I can ask for the double screen just for understand what we are doing as a treatment. There is some reflex. Maybe here is better. Okay, thank you, Francesco. Thank you very much. So we said we already put the plate under the back in this case. Imagine that we want to release the, for example, the superior trapezius or the scalene area or the sternocleido muscle. Well, it's very easy to detect and have the right idea and the proper positioning for treating. We can use the fascial program, resistive, as we said. I put, for example, 30% of power, not so much. Okay. I take a bit of cream and I start with the treatment. Of course, I haven't prepared a tissue. Just imagine that you can do the preparation of the tissue, or we can just stay with the electrode in a flat position close to the area that we want to treat. Be careful with the carotid sinus, so not go on the anterior part of the neck, of course. I just put the electrode, the fascia tool, in a lateral position. I'm here over the scalene muscles, the posterior, the medium, and the anterior scalene. I'm just doing a very small, rounded, and delicate movement. Okay, she's not perceiving a very increasing in temperature. She refer a 1 in a scale between 0 and 10. Okay, so after warming up a bit, and have a look also at the screen, as you can see here, we get a yellow histogram, so we are promoting a very gentle increasing in temperature. I can start with the lateral edge, the 30-degree edge. You remember that we got a 30-degree angle edge, and I'm using that for scanning the tissue. So here I'm scanning, for example, the posterior, the anterior gyna of the superior trapezius. Okay, the scalene muscles, and also the back part of the sternocleidomastoid muscle. So it's very easy, very gentle, no pain for the patient. I can use also the double edge with a double curve, very easy for grab the sternocleidomastoid muscle and reach the mastoid process. I can also change the manuality from forward to backward. Always I stay in contact with the patient. I never take it away and go touch and go, touch and go, because I want to benefit from the current. It's a very gentle treatment, and I can combine also with a bit of kinesis. For example, here I find a very big trigger point, so I stay fixed with my right hand, and I can do a very gentle movement. Is a side bending left movement, myofascial release techniques, just for release the trigger. And in a few seconds, the trigger is solved, completely solved. So as you can see, the intensity is not so high. We don't need a very big amounts of current. So, well, it works. I haven't checked before the joint movement, the accessory movement between the first vertebra and the occiput. Okay, but I already understood that now is absolutely there is more movement, more range of movement. Okay. So, for example, if you want to treat, remember that neck, the anterior part, like the sternocleido, for reduce the tension, we can use in this way, using the double edge across the sternocleidomastoid muscle. Caldo? Okay, she's referring 5 to 10, 5 in a scale to 0 to 10 warming effect, so not very high. Is in line with the colors of the histogram. Yeah, we are relaxing all the lateral to anterior part of the neck, and of course here we can treat a lot of different problems also for the thoracic outlet syndrome or the small pectoralis problems with the cervical plexum. Chris, do you have any ideas what we can suggest, what we can show?
Hi. Yes,
Hi,
this technique for this area for me is perfect. Hello. For this area, for me, the TECAR is perfect because for the example that you gave with the flexion of the neck, we usually have a lot of retraction in the anterior muscles of the neck and a lot of soreness and tension on the back because there is an overload of the back muscles. So we work with a relaxing mode and to oxygenate the muscles from the back, and then releasing the anterior muscles from the neck so we can have a better head posture and diminish this overload that you showed in the study that is on the screen. And even after we perform this release, we can go, as we spoke before, we can go ahead to like an RPG posture for the anterior chain. So the results are even better because we made a previous release of those tensions and those muscles. So the results are really improved.
Great, great. I think we can arrange something. I got an idea. Tell me, what do you think about this idea? So talking about RPG, I'm thinking a lot about the diaphragm. The diaphragm has a very key role for all the changings in our muscular change, in our the global posture. So what do you think if we try to do with the hands-free treatment for the diaphragm, and on the same time maybe you suggest to me a posture for the anterior chain, maybe? What do you think about that?
Sure. Great.
Okay.
Yes, of course.
Okay. So I try to arrange this. So what we need is just the plate under the back, as we did just before, and maybe we can set up 2 electrodes for each the diaphragm area. So depending if the diaphragm is very high, is very blocked, maybe we can, let me check. Try to do a breathe, fai un respiro con la pancia. Prova a spingermi su. E fuori. All right, in this case, perfect. We have a very blocked diaphragm here, so it's good to have to show
a perfect model.
Yeah, exactly. Quindi facciamo così, questo è un po' più alto. So always be sure that the plate is in contact with the skin. And for example, here, yes, we can use the diaphragm. Maybe just 1 plate for at the beginning. For example, in this case, I suggest the adhesive plate. Maybe it's better. So the adhesive,
yeah.
we can put over here. We don't need this. Let me check another one. 1 second, I'm back.
That's a good idea, because as we are thinking about diaphragm, then we lose the black band. Is good for her to breathe normally. So
Yeah. So we just need to connect the cable. Just let me remind that if the surface of the electrode is smaller than the plate, we are focusing the energy more in the upper part of the geometry. This is always a very important thing to remind, because it's like, I remember one webinar that we did last week with Esmeralda and Paco, and they explained this very well. Both electrodes are active electrodes. So there is not a passive electrode and an active electrode. Depending on the size, we are concentrating the energy between one pole or the other pole. So in this case, this is smaller, so we are attracting the energy more on the surface. Okay. Okay. So I connect the blue cable. Okay. So I suggest maybe we can start with a small to medium geometry, maybe a medium one. Okay. I set up 35% of amount of energy. Please suggest me the posture that you want to do with Federica, the exercise.
okay, she can be lying in this position. We would just ask her to put, her head has to be in a neutral position, and then in this position that we are seeing here, we can see that she has some shoulder flexion. We would have to position her scapula to be in a neutral position, and her hands could be facing up. Yeah, and then the hands up, facing up, the hands, just to tension the pectoralis. Yes, that's it. Okay.
Maybe you'd
And
like
then
to have an RPG bed, maybe like this.
yeah, we can work that more in abduction or adduction, depending on the retractions of the pectoralis, you know. And for her leg, she could flex her hip and knee, a flexion of the hip and the knee. Yeah, because in this position, her back has to be all flat over the surface. So she has to have all her spinal areas all flat over the surface. So any spaces can be over there. So the idea is to extend her leg the more she can to do okay, so yes, the more you extend the hip and the knee, the more you have tension over the anterior muscle chain. So we can start from this point, and
We need to open the knees or not?
yes, you can do it a little bit. Yeah, you can. We can evaluate her muscles involved in the hip, and if you need it, yeah, that's she can close a little bit, just a little bit.
In this direction?
A little. No, keeping that just the knee. You can close for a little adduction.
Okay.
And that's it. Okay, she can sustain the posture over there. Okay.
Wow.
And then she will, it's complex. And then she will start to breathe. And as she's breathing, of course, we have a specific breathing way for the RPG. But as she's breathing, she's tensioning the diaphragm and all the fascias that emerge from it. So it's very interesting. She will do an inspiration, a very inspiration, and then she will exhale, contracting her ribs and the abdomen, and then she will do a contraction of the. Yes, and when she loses all the air, she will start again with a new inspiration, but she can't lose any contact with the surface, and she can't do, you can see from her moment now that she's pulling off the shoulder from the surface, so she would have to correct that. Yeah. And we keep all the time that we are posturing the patient, we keep correcting those tensions are going to show, and then we do, okay, put your shoulder back, okay, your knee is opening, close your knee, okay, breathe, don't stop breathing. We keep organizing her all the time of the posture that we are working. Yes. So sometimes what the patient does is when he breathes, it goes like this. The tension shows. So we correct him. No, this is the position. Keep it here.
Right now, Federica is gonna bend on the right side.
Because probably that's why she has more retraction. So we correct that, and she keeps breathing. And with the inhale and exhale, she will tension the fascias, and it will show where are the tensions on her. So we can manage that. It's very interesting.
Great. Yeah, super. So is it difficult or difficile? No. Okay. It's just
because she's 2 minutes. After 20 minutes, you ask her again. She will say, "Okay, yeah. I'm tired."
Sure, for sure. Okay, thank you very much, Chris, for this demonstration of RPG and combining also with the hands-free. What do you feel some warming here? Okay. On the upper part or lower part? Okay, she said on the upper part, so in the area of the diaphragm. Especially here is one of the most easy point of stiffness of the diaphragm, the apophysis xiphoidea. All right, so going ahead, so you can relax right now, Federica. Yes, Ben. Perfect. Okay, going ahead. Are there any questions?
Yes, there is a question about the use of TECAR with TMJ issues.
Yeah.
Later we will speak about that.
And
Soon, actually.
There is another question in Spanish, so let me translate. How would you work with a diastasis abdominis
Sí.
with the electrodes and straight?
Yeah, good question. Yes, with the diastasis, we know that there is a range of intervention, and depending on the centimeters of diastasis, we know that there are some diastasis that has could be treated by the physios. We can roll in, and others that are absolutely a surgical diastasis. But until the 2 centimeters, 2.5 centimeters, we can treat absolutely. So we can use the hands-free adhesive or the fixed one on the lateral part, one on the right side and one on the other part. So promoting the current in a very superficial plane. Okay, so we are promoting the collagen synthesis and also the fibroblast activity. I don't suggest you to use temperature, but to use athermical intensity. That's why, because we know that if we increase too much the temperature, the tissue becomes more relaxed, so we can increase the diastasis. In this case, we don't want to relax the muscles, but we want to tighten the muscles. We want to activate also the transverse of abdomens, for example. And I suggest to use the athermal window. So you can use both electrodes on side bending on the anterior part of the belly, and that's all. Any other questions, maybe, or effects on the viscera? Yeah, the effect, for example, about this question, what are the effects on the viscera? Well, on the most advanced course that we did, we explained exactly what the current, the route that the current has inside our body. The viscera are not so affected because the current goes to the superficial layers. Okay, so we don't have effects on the viscera. We are always superficial, and by using the frequency, you can decide the level of deepness. So if you want to be sure to use very superficial warming effects, you just need to select superficial and a high level of frequency, like 700, for example. Well, there is really a lot of questions. A lot of people are asking things. I hope in the next days we can type to everyone. Okay, that's going ahead. All right, the cervicobrachial syndrome. Just have a look of what we can have. Of course, all the roots of the upper limb could be affected. We can speak about herniation of the disc, or thoracic outlet syndrome, or impingement under the pectoralis, or could be a double crest syndrome, or like we see last time on the upper limb section, a problem with the median nerve around the wrist area. So what I suggest always is the proper evolution. So identify where is the problem, if there is a wrist, if it's on the elbow, if it is a neck problem, and we can combine different techniques. For example, using the plate under the shoulder blade, as we did last time, using, for example, the traditional resistive. Puoi farlo zoom out, per favore? Okay, okay, so sorry guys. So we can do here, for example, some mobilization. Here we are performing the normal monopolar electrode resistive on the wrist. This could be a very good geometry for a wrist pathology. So if the nerve is impinged on the end area, or we can use, for example, for a teres impingement, over here. You know, this syndrome where you get the median nerve that is compressed. But we can use also other possibilities. For example, we can also have the plate under the hand, and with a small resistive electrode, we can treat directly the area that is affected. For example, the thoracic outlet syndrome, or if we go on the other part, if we cross, we are very sure to affect the root of the nerve. Right? Treating with this kind of geometry, from this point to the other one, we are very sure to treat and affect the whole root. I usually work with very close geometry because I think that the most important thing is identify the impingement area, if there is a problem with a facet, if there is an hypomobility that induces an hypermobility and produces a cervicobrachialgia, if there is a small pectoralis that is very stiff and is tight and is compressed, the nerves. So I usually work with small geometries. I'm working directly on those, especially with fascia tools, and then maybe some mobilization, of course, like we did for the upper limb section. You remember the the lateral position, and moving the arm and the scapula of the patient. So that, I think, is the most effective way, and you don't lose the energy in very big geometries. Okay, so face up, pancia verso l'alto. Other position, for example, could be this one. You have your electrode on your right hand, like this. And I'm working directly on the root nerve, and I'm doing some mobilization, attentioning, for example, of the nerve, of the myofascial chain, or working on the pectoralis, for example, or the anterior neck chain. That's it. So, going ahead. So we don't have so much time. I don't want to spend. Yeah, the TMJ dysfunction. If you can have a zoom in here, I can just have a brief introduction on the anatomy, because always we have to be very sure on what we are treating at. So keep in mind the temporalis, keep in mind the masseteris. Here we got a TMJ joint. Okay, as you know, we got the articular disc, and all the capsula is one of our targets. So it could be very easy to treat all this connective tissue around the joint. Another point is the muscles under the joint. So the anterior neck muscles, we have to keep in mind the hyoid bone, and the the proximal and the distal muscles over the hyoid muscle, over the hyoid bone. Especially if we are talking about swallowing problems. Let me show you something in here. So it could be very easy. All right, so we identify the area. One very important thing is the parotid salivary gland. So keep in mind that if we want to treat the masseter area, we have to remind that we have a parotid salivary gland here. So don't treat over here with the tool, of course. We can treat under here, but not directly on the parotid salivary gland. So I suggest you, in this case, we can remove. This is a very helpful software. We can remove the gland, okay? So we can better understand which are the muscles. So we said the temporalis that has the insertion on the coronoid process. We have the masseter superior, and if I go on the lower planes, here we go, the masseter deep muscle. So these are the main target for our treatment, okay? Of course, if I remove, for example, the jaw, we got other muscles that we can understand that maybe those that are treating the anti-enjoy knows the external pterygoideus and also the internal one, for example, this internal pterygoideus. These are the very important muscles that need to be treated. So speaking about the TENJOY, there is really a lot of things to say, but just keep in mind that if we are doing, if we have an instability problem, maybe the right exercise could be the Rocabado exercises or some protocols that can fix the joint. Okay. On the other hand, if we have some stiffness problem, all right, the YAST technology, the YAST tools could be very helpful for your everyday clinical practice. So I show you just some very easy way of treating the TMJ. So using the plate in the upper part of the trunk, okay, then we can use the DIABLADE small tool. Okay. Let me take it. Well, I forgot our here. So I select the fascia program. Very gentle current, like maximum 20%, for example. Of course, this area will be treated with the normal monopolar electrodes. For example, the masseter area. Maybe it's not so easy to see with the camera, but here I'm over the joint. Okay, I'm over the joint, and with this part here of the tool, with the most small part, and grabbing the tool with a more close position like this. So I'm not grab here on the handle, but I'm grabbing more in a distal portion. I can easily treat directly over the joint. Okay. Okay. Little bit of cream, of course. Okay, we close the circuit, so it's very easy to stay with a very, very gentle pressure over the TMJ joint. Or we can treat the masseter area, for example. Of course, we have to understand all the evolution of the TMJ, like the understanding the movement, the patterns. I suggest to you to work with a dentist specialized in the TMJ dysfunction, and to have a partnership with him or her for a better understanding of the pathology of the patient. Chris, do you have any experience with the treatment of the TMJ?
Yes, actually I had a couple of patients that had teeth extraction surgery. Oh, wow. And they had some complications like infection after the surgery, and they had to be hospitalized to do the antibiotic treatment. So because of the long period over there, they couldn't barely open their mouth. When they came to physical therapy, they could open less than a centimeter of the mouth. So it was very incapacitating. They couldn't speak. Their speech were very difficult, and to eat, and they were very nervous about that. So I made a 10-session treatment, of course, combining capacitive and resistive mode, capacitive for the muscle stiffness and the resistive over the TMJ joint. So in 10 sessions, they were absolutely normal. It was really, really fast results, and they were very glad. So at the end of 10 sessions, they had the full range of movement. So it was great.
Great.
I also worked with the capacitive mode to work over the neck muscles to do a release. Yes, because there were a lot of tension. They were so nervous about what happened, and the stiffness from of the facial muscles. So it of course it works together with the neck, and it was a really great results over those patients.
Great, great. So thank you for your experience. I think we are well, we reached the 2 hours of webinar, so I think we can stop right here. Or maybe if there are any questions, I see a lot of questions actually.
There is maybe one last question if you have time.
It's okay, it's okay. Maybe one.
Is it possible to use the fascia tools with the
Dupuytren.
Dupuytren pathology?
Yes,
And
absolutely.
what is the protocol that you recommend?
Wow, yes, this is for the upper limb, of course. Dupuytren is a retraction of the palmar fascia. So you have this classical flexion of the last fingers. Well, it's very easy to have amazing results with this pathology. As we know, is also an autoimmune system, autoimmune pathology. So we have to take in account of the systemic rule on this pathology. But on speaking just on the superficial, I mean not superficial, about the fascial rule, okay, we can solve the entire retraction by treating the forearm with the, well, it's very easy preparing the tissue, preparing the forearm with the capacitive, also with the resistive, because the forearm restriction are very stiff, are very dry tissues, and then going with the DIACARE mold directly on the densification on the palm of the hand. So very great results with the Dupuytren syndrome. Okay, please guys, come here. I think we can say, first of all, thank you very much to Chris for your experience and for the opportunity, because it's very really there. So really thank you very much.
Yes, probably we didn't say that Chris is in Brazil, so you are like 6 hours behind us.
Now it's 7 o'clock in the morning.
Oh, good.
Okay, so thank you very much.
Thank you for having me. I'm very glad to be with you again, and it's always a pleasure to be with you guys.
Thank you. It's a pleasure for us. Obrigado.
Of course, thank you to Enrico.
Thank you,
thank you again. Thank you to Federica.
Thank you, Federica. Yes.
And I think we can anyway stay tuned. You will always find news about our webinar on our website, so please visit both tecartherapy.com and globuscorporation.com. We will also like to say that this week we start with a webinar for the Kineo, our robotic machine for rehabilitation and high performance. The first one will be on the 23rd, 10 a.m. So on this Thursday, 10 a.m. Italian time. Please also join that webinar. And anyway, we will roll out many more webinars during the next few weeks. And also we will have all the online videos that you can find and watch whenever you want on our website. And also we are creating now the podcast section on our website. So you will see, you will be able to watch again and again these webinars we have done with Enrico and with our specialists around the world. I don't know if Mauro has something to add.
Just thanks to everyone that enjoyed from the beginning our webinars. It was a very great experience for all of us, and I hope for all of you as well. And nothing else, just thank you and see you soon.
Thank you.
Bye-bye. Thank you.
Bye-bye.
Ciao, Chris.
Ciao,
See
ciao.
you guys. Take
Ciao.
care.
See you. Bye-bye.